Hello, and welcome to today's episode of Health University, where we're exploring all areas of your fertile health. And I have the great pleasure today of having with me Alexandra Geary-Stock. Alexandra's a psychotherapist in the San Francisco area, and she has a particular focus in helping women, people, couples navigate fertility in general and including the IVF journey. So welcome, Alexandra, and I invite you to expand upon my brief introduction with whatever else you want to share with the listening audience.
Yeah, thank you so much for having me. I'm thrilled to talk all things fertility related. Yeah, so I work a lot with people who are thinking about parenthood, struggling to become parents, so specifically IVF interventions, and then the transition into parenthood in my private practice. So there's some common themes that I see people coming through when they do get to see me. They have really experienced quite a bit of loss. It's a little bit later in their journey.
Yeah.
And I really see people completely depleted and exhausted from the journey. Mm-hmm. There's a bit of a cycle that happens for people each month, kind of getting hopeful and then feeling quite defeated. Right. And it becomes a lot of loss.
Yeah. I find the same. Yeah, I find the same experience as well. But often by the time someone's coming to my door, she or they have been through, months to years of struggle, and it's affecting all areas of their lives, personal, professional, intimate relationships. And so I think it behooves us to acknowledge, the degree and the levels and areas of suffering that encourage that a person is going through. So, to just put the right prism on it, it really is a courageous journey. So
absolutely.
Yeah, I wanted to go through some questions that we had talked about prior to this call and to hear from you. What do you find that people report that it's like when they're struggling with their journey? What are their words that they use so that listeners can kind of recognize that, we're not alone in these journeys?
Yeah, I think hopelessness is one that comes to mind that I hear a lot, just feeling so defeated and then really wanting this so badly, wanting a family more than anything. It's then hard to find the motivation to continue on, and it can feel just relentless, like a relentless journey, and trying to find energy to continue on each cycle after such defeat and often, a loss. This is a journey of real loss. It's not just one loss, it's multiple losses that could look so many ways, from not achieving the outcome a given month to actual pregnancy loss. And so it really becomes, for a lot of people that come to see me, it's really about kind of dealing with complex trauma.
Yeah.
And I think it's just an onion of grief that people are dealing with, grief in all ways.
Absolutely. And, of course, grief is a human experience, and I think that as a culture, we tend to shy away from it. But I would also say that the repeated cycles of grief can become the thing that really chips away at a person's sense of self. So what tools or techniques do you find have been useful for you and your clients as they, kind of decide to persevere or decide that they're finished with the journey? Because really any decision is their right decision.
Yeah, absolutely. Well, I think the first step is kind of acknowledging the grief and really exploring the grief and how it's in so many varied ways. I think that oftentimes it's a grief, fertility, struggling with fertility, having this health diagnosis is something that goes greatly unacknowledged. And the kind of chronic grief that people are experiencing is just not addressed. A lot of times family members don't completely understand. Friends who are not on the journey themselves don't understand. And then, of course, society as a whole is not very understanding. I think there is still quite a stigma, and people from a young age haven't been told, oh, you might struggle with fertility. In fact, they've been given the opposite messages that, you can have this family you want at the time that you want. So I think starting to unpack with clients is really useful. That, there is a valid reason here, right? That they are in this kind of grief cycle and really having a chance to grieve together.
Yeah. And people express their grief or experience their grief differently. I know that a part of your work is handling the emotions of sort of resentment, anger, irritability, or even kind of sort of that manic, like everything's fine, when deep inside it's not. So are there methods or practices that you use that will help someone recognize where they're maybe not even experiencing for themselves that they're going through what is truly a grieving process?
Yeah, oftentimes what I see in my practice is people pretty in touch with their grief who are coming in. They're actually consumed by it, and they've been consumed by the constant decision making that comes along with the fertility journey, as you know. People are having to make decisions. Do we continue on this month? Do we persevere? Do we take a break? Do we start utilizing fertility interventions? And so people are pretty in touch with the grief. It's really what I see their friends and family being a little disconnected from what they're going through and the isolation they experience, and sometimes or in the dyad, in the relationship, there being a way that two different people are experiencing grief very differently. So getting, on the same page as each other, and having conversations with friends and families so that clients feel a little less isolated. In addition to talking about different distraction activities, because most people on the fertility journey are pretty consumed by it. And so it can be really, really helpful to think about ways to get some relief and those different kind of self-care activities.
And what might some examples be of the sort of distraction activities or sort of expansive activities that let them know that they are more than this journey that they're experiencing at the forefront of their mind?
Yeah, anything that they were doing or that they loved pre-fertility journey is a really good, getting back to old hobbies or anything that they love, like hiking, listening to different kind of podcasts that are not fertility related. There's great fertility related podcasts out there. Sometimes talking to friends about not actually bringing up their fertility journey is really useful. And so that they can have conversations that are completely absent of this part of their identity for now and this part of their life. Of course, accessing support is crucial.
Of course. I think that you've touched on something that's really important. How does a person or a couple take charge, if you will, of the conversation with their friends or family so that they can ask for what they need and then ask not to be in a conversation for what they don't need, what isn't serving them?
Yeah, it's such a good question. It's hard. This piece is really hard for people to navigate. Oftentimes they already feel burdened by their fertility journey, so to then have to educate their loved ones can be very tiresome, going back to this exhaustion that a lot of people experience on this journey. And so I have created a handout that people find useful called MAD.
I love
MAAD.
I love that. It's MAD, MAAD. So let's hear about that. I think it's brilliant because it really does. It explains in a word, what the person or the couple feels, and I love the descriptions help the couple, the person, the couple, and the people who love them know what to do and what not to do. So let's hear.
Yeah, absolutely. So this is how to really not make fertility people mad that I prefer. And these are actual examples. It's just not something that we're thinking about. It's actually things that have hurt people that loved ones have said with good intention. But the first being in the MAD acronym, not minimizing people's, saying things like, oh, it could be better. You don't worry, this is going to happen for you. It could be worse. You have all this free time. You might as well enjoy it. Think of all the sleep you're getting, and kind of dismissing the pain and the grief that we just talked about in any kind of way, offering congratulations for them if they've started a fertility intervention or they're in a cycle trying to conceive, as if they're going to just achieve their outcome, making an assumption that someone on the fertility journey is going to be quote unquote successful. Right. Yeah. So any minimizing of their physical experience or their emotional experience. And then the next one is the A, one of the A's.
The first of the three A's. Let's hear.
Which comes up quite a lot, is offering alternatives So things that start with, have you considered? Have you thought about? And then whatever the person is trying to offer as an alternative.
Just have a glass of wine, and it will
Right.
the absolute opposite of what they're otherwise being informed and educated to do. Right. Yeah.
Yeah. Stop stressing.
Right.
Have you tried this? Have you tried that?
Have you ever been successful when someone says stop stressing? I know I haven't, for one.
Definitely not. Definitely not helpful. People on the fertility journey, like I said, are consumed by this. They've thought of everything. So offering what you think might be best for them, or, some anecdote is not helpful. So the other A then that follows is offering anecdotes that can be extremely painful when you offer a story of someone that has had success. If they only did this or that, any kind of comparing could be really hurtful and not useful. Yeah. And then the next A, final A, being an authority. So thinking what the right decision is. Oh, you should stop now. Oh, just keep going. Oh, try IVF, 3 times. It's really helpful to just listen to people and what they need on the path, not think that what's best for them. I think this can come up a lot for providers and in the fertility space, well-intended, but can offer kind of an authority about what they think is needed for the next step for the couple or the person. And that often is just really painful and not useful.
Yeah. That's a tricky one, isn't it, though? Because it is a fine line between knowing suggestions and giving perhaps, information on what could be on a timeline of next steps, and delivering that in such a way that it isn't given as an authority figure that you should do this next. Yeah,
absolutely.
And I think it also falls, in my observation with patients, it also falls heavily when an authority figure, a parent, a sibling, a boss, someone to whom they've already given some, ascribed some authority, when that person comes in with ideas, it's kind of hard for the individual to filter those ideas as something other than, oh, I should do this next.
Absolutely. And I think, this is, often is coming from such a place of wanting to help the person struggling, right? And I think people on the outside can really feel powerless. And, as a kind of trying to manage their own feelings of powerlessness, they want to kind of offer something that feels powerful. And that often is just not the most helpful approach.
Yeah, I can confess that not in the treatment room, but in my own personal, intimate relationships and, family and friends and loved ones, I want to go into fix-it mode. And thankfully, my own daughter is a psychologist, so she's trained me on how to take a minute and think about or reframe my impulse to want to help that way, because it's not helpful.
No, but it is so natural, right?
Yeah.
When one feels particularly powerless and wants to help. Yeah. It's completely understandable.
Right. And now we've got a D. We've got a D.
We do
in our mad acronym.
Well, that's really important one, which is don't discuss it, which is a nice way of saying gaslight. So this happens a lot. I'm still always so shocked to hear what I hear about people really gaslighting those on the fertility journey. And particularly, I hear a lot referencing age, that, oh, why did you wait so long? Why didn't you do some fertility preservation earlier? Why didn't you freeze your eggs? A lot of blame.
So what might someone do? Well, I'm going to both sides. What might someone do who's on the fertility journey and needs to take the reins, if you will, in managing some of these, personal relationships where she or they are feeling like that the other is giving, advice or gaslighting or, trying to fix it. How does the individual take a stand for herself or themselves and really regain power and control over the experience?
Yeah, it's not easy, right? Because she or they are already dealing with so much, or they're already feeling quite burdened. So this setting boundaries, which you do have to do in this setting, really does take a lot of navigating, but I think it can be helpful to pull on some of these resources, like even sending along something like this acronym MAD, or there are other really helpful articles out there about kind of what to say, what not to say, can be helpful as a starting point of a conversation, or taking pieces of the acronym and saying, and practicing, you might have to role play at first, but really practicing how to say, like, I understand you're coming from a place of wanting to help, and I can understand that. And this kind of messaging hasn't been useful for me.
Yeah. Brilliant. Yes. Yeah. Really, you're almost either anticipating or interrupting if it's in play by just kind of naming it, right? Lovingly and with a sense of self, kind of calling out, oh, this is what's happening for me right now. Can we redirect the course of our conversation?
I think, though, yeah, absolutely. I think there's often what I find a step before that, which is the client, the person really starting to understand that their experience is valid, and what they're feeling and how they're maybe feeling hurt by people saying unintentionally painful things is valid. And so that can give them some empowerment then to set these kind of boundaries. Because I think a lot of times people on the journey haven't felt validated.
Quite the contrary, actually. Yeah. And so are there sort of tools or techniques or kind of homework that someone can do to sort of regain that sense of validation, self-validation, before finding oneself, kind of on your heels, expecting to go into the ring, so to speak, with some well-meaning someone who is otherwise leaving you feeling unvalidated? Are there resources that you'd recommend? Or
yeah, I think therapy is a really good place to do that. In addition to finding like-minded individuals and people who are on the path, that's usually very useful for people struggling with fertility, is to find other people who are also struggling, and accessing different resources, support resources like Resolve. The Resolve group is a wonderful resource, or people who've had pregnancy loss, accessing an amazing organization like HAND, where there is a chance to talk to other people who have been through the journey. And by talking to other people who have been through the journey, on the journey, that can feel extremely validating.
Yeah, I want to just repeat, Resolve.
You're seeing.
Oh, excuse me. I'm so sorry. There was a slight delay. So Resolve, these will be in the show notes. Resolve is a wonderful resource, and HAND is a wonderful resource for someone who has suffered pregnancy loss and wants to get some support and kinship around that. And I think, if I may, I'd like to just put in a plug to utilize well-resourced resources, not necessarily a Facebook chat group that you don't know if it's being well managed. You want a licensed therapist who is skilled in helping to navigate the conversation, so that one person suffering doesn't take everybody down a rabbit hole, so that you leave a conversation feeling supported and resourced.
Absolutely. Yeah, I think that is invaluable, that you have, either you're working with a professional or you're in a support group where people are listening and you feel seen and heard. That can just be so empowering and validating.
Yeah. And I'm kind of all for both. That's where I like to, or I find that people feel the most supported, is that they have their individual therapy where it's just them and their own, experience, because your own experience is unique and it warrants being seen and understood, and helping you sort of tease out what might be happening and how you could resolve some of this. And then the larger groups that are managed by a licensed therapist or psychotherapist who's been trained to help make sure that the conversation stays at a level where everybody's getting a takeaway that is of support.
Absolutely. Yeah. Of course, there's common themes on the fertility journey, but everyone has their unique story and unique experience, of course. So it's really finding support that matches both those things.
Right, right. I'd like to, if I may, touch upon the partnership. I mean, obviously, there are people who are going through single parenthood by choice and are going straight into, assisted reproductive therapies. Oftentimes, in my 23 years, it's a couple of who are going through it together, and I find it uniquely heart-wrenching what the couple goes through, because they start out on this journey, as you say, thinking it's going to be a slam dunk, and then they realize they're having trouble, and they're having trouble together, and they're having trouble independently. So how might you, counsel or advise the partner of the person who is trying to conceive?
So this is my special interest, actually working with the partner, because oftentimes the woman has quite a bit of resource available to her, but then the person who's not trying to conceive or supporting the conceiving process is often doesn't have as many resources available to them. And so it is really important that there's a space for that experience, and that there's a space for their story, which honestly oftentimes does look very different in the dyad.
I was going to ask, could you give an example, so like what it might look like for the partner, so that the people out there listening might say, oh my goodness, I really recognize that in myself or in my partner, and I hadn't really thought of it before as their struggle in our struggle.
Yeah. I think one thing that comes up a lot, there's several things, but one thing that comes up a lot is that the partner feels helpless, or kind of, again, going back to this powerless experience. They can feel very powerless. They don't know how to help. They don't know what to do. They can see their partner really struggling, really feeling in certain moments like their body has failed them, and they're not sure what they can do to make things better. Often that can be the partner, if you've done fertility intervention that maybe doesn't have the fertility diagnosis, the one that isn't going through all the treatments, and they can just be at a loss of how to help, but also have equal amounts of hopelessness that they don't feel that they can really share, because they feel like, well, I have to give space to my partner who seems to be struggling
that person worse than mine.
Yes.
So, but it's not, it's just different. So what are there any, here again, tools, techniques, suggestions that you would give the partner?
I think that that's where therapy becomes really useful, is having a space for these, for both partners to be able to communicate their experience with each other. Because sometimes what I found is that there is one partner that might be holding back. They don't feel like they can burden their partner with their emotional experience. So really giving space, and, with someone who isn't in the dyad is very helpful, so that both, like, the couple feels supported as a couple, the individuals in the couple also feel supported. I think that can be really, really helpful.
So couples therapy to include the partner in the conversation, because the person trying to conceive has lots of authorities out there making, prescription and recommendations, whereas the partner is just kind of waiting for some news.
Yeah, and I think oftentimes it can even feel like the partner is not in the process. Like we even use this language right? Like the woman, usually the woman, right? Like is the main focus, and she's conceiving. It's like, well, the couple is actually conceiving, right? They're trying to conceive, and so the other partner can really get lost.
Yeah.
And so having space, of course, in individual therapy for the partner, but as a couple is crucial.
I couldn't agree more. And thank you for that. This is your area of specialty, because it really is kind of a lost thought until or unless it gets almost, far down the road of a struggle. What about the
it's really, yeah.
Let's talk about how can you be a better, co-worker, boss, human resources manager, all of the above?
Yeah, it's such a great question. What I found is there's still really not a lot of acknowledgement about fertility related struggles, and fertility being a health related issue.
Ironic, right? Since 1 in 6 people are struggling with it, and it's just this year, practically last year, getting the attention as a health related condition, now has a medical diagnosis that it never had before. So yes, sorry, I'm enthusiastic about the conversation. So but please continue.
Yes, completely right. It's really important, I think, for HR and managers to understand the impact, the burden that couples are faced or people are faced who are struggling with fertility, and obviously often needing PTO, particularly people who are going through fertility treatment. That's a whole nother topic that takes unbelievable time and energy. But also giving emotional space and understanding the mental load that this takes for the dyad and or the individual faced with the kind of onion of grief, as we're talking about, and just the unbelievable exhaustion that people are up against when they're on this journey, and any kind of support that they're getting for their health, acupuncture, other kinds of treatments are, it takes time, and hopefully places of employment need to start being more aware of that, that people do need this kind of support, and being able to talk about that, of course, with a supportive manager is important if that seems appropriate. The other thing I find is kind of back to the MAD acronym. A lot of times coworkers don't know how to talk to their patients, clients who are struggling with fertility. So sometimes there can be things that are said that are painful. A lot of times people struggling with fertility are very sensitive to different things that are triggering in a way that someone who isn't on the journey isn't experiencing. So coworkers saying things like, I hear this a lot, like saying like, oh, you and your partner have been together for a long time. So when are the kids coming? Or, wow, I thought you'd be expecting by now. So I hear all kinds of things that I'm just appalled by people's lack, again, well-intended, I think, supportive.
Well-intended, but thoughtless, right? It's really about just taking that minute to ask yourself, is this really supportive? Because you don't know what's going on. Another thing that comes to my mind in the workplace is that, so many of us are now working remotely. Mm-hmm. So so we don't even have the, water cooler experience, or the let's go to lunch or let's go have a coffee, well, or tea in this case, to kind of unload or share. So that sense of isolation is even greater because this person is now leading a team or executive director level and has to stay at this sort of elevated space for others when she or they are going through such difficulty, on their own, that is only exacerbated when there is, sort of an IVF cycle taking place, because when you're being injected with hormones and running to appointments, and it's exhausting.
Yes, absolutely. Yeah.
So how might a person, for those who are in sort of either a hybrid or a remote work environment, and you've got, six other people who could be pregnant at any time or not, because 1 in 6 is struggling with infertility, how might we think about connecting with our, on a professional level, on a supportive level, that would be able to let this person, who's struggling, either have space or feel supported or feel.
Yeah, well, what I found is that a lot of clients, a lot of people aren't actually disclosing this. And I think the remote work has made that even more true. It just, as you said, it has really added to isolation. And so feeling even more like they have to hide this part of themselves. So it makes it even more important to access a space where there are people, a safe space, where there are similar people on the journey, where people who are on the journey can feel, heard and understood. I think in general, for people in the workplace, should be something I feel like I even need to say. It should be kind of obvious, but you probably shouldn't be making comments about people's reproductive health at all.
Big show.
Comments, curiosity, about, oh, when are you going to start a family? Oh, gosh, so I think it just is, a question that, and a topic that doesn't need to really come up unless a person, wants that kind of support. But what I see is typically people just wanting to keep that information to themselves because they don't feel safe. Right. And they don't feel safe because people, as you said, they're not thinking. If you're not in it, you maybe just don't understand what it's like.
Right. Yeah. So I think what I would like to just convey out there is presume that someone in your circle, if you got 6 women or 6 people who are of childbearing age, someone's probably struggling. That's the statistic. So have that level of thoughtfulness when you might want to, say, well, congratulations on your wedding. When will the babies come? There isn't necessarily a sequence of events anymore, and that person may have been trying for years, and a wedding is not the thing that is going to magically have a baby appear. So just that level of thoughtfulness and kindness, really, it really becomes down to a kindness.
Absolutely.
Yeah. Well, I want to be respectful of your time and the listening audience's time. So all of these things, the MAD flyer will be, the link to the MAD flyer will be in the show notes. The link to Alexandra's site will be in the show notes, where you can pick up other resources. Links to Resolve and to Hand will be in the show notes. But is there anything that you want to make sure that the listening audience has as a takeaway before we wrap it up?
Just that, people on their fertility journey are really struggling with kind of an onion of grief. Mm-hmm. And anything that people can do to support people on that journey is incredibly helpful. Any kind of awareness that can be spread, I think, goes a really long way.
Yeah, I couldn't agree more. Well, I thank you for your time. I think we can't hear this enough, because we kind of know it intuitively, but we have to hear things multiple times with different language and different voices before it kind of sinks in, and we go, oh my goodness, I was doing that. Or I almost did that. And hooray for us, we can stop and say, I almost did that, but I didn't, because then you're on the way to your own learning and growth improvement as well. So
absolutely. Well, thank you so much.
My pleasure. Thanks for your time. And audience, we will be back for our next episode of Health University. And as I like to say at the close, class dismissed.